Bonnet.
And we are keeping it real.
On all things women's health.
Cheers.
Cheers.
So, I hear the word thrown around all the time, endometriosis. What is it?
That's a good question. So, endometriosis basically is a word that describes the lining of the uterus outside of the uterus. So, it's a condition that affects 1 out of 9 women.
That's a lot.
That's a lot, yeah. And considering like different diseases, like, that are very common and everybody knows about breast cancer, but not everybody heard about endometriosis, right? So in this condition, you have the lining of the uterus that, as it sounds like, should be inside the uterus, it's outside of the uterus. So it can be anywhere in the body. Like,
whoa.
Yeah. Most commonly in the pelvis, but it has been found anywhere in the body, in any organ that you can think about. Has been endometriosis.
What causes it?
So it's an inflammatory process, right, basically. So that tissue that's supposed to be inside the uterus grows outside of the uterus. And once it grows outside of the uterus, it creates inflammation. Now, there are multiple factors to it, so we're not going to make it too complicated. Right? We're gonna
make it where we can understand.
Yeah,
everybody can
exactly.
understand.
We're not going to make a lecture in medicine.
Okay, thank you.
So we're going to keep it simple. But basically, that tissue that is supposed to be inside the uterus, when it grows outside, it's not normal for the body, right? So when something is not normal for our body, the immune system kicks in. Right?
And attacks it.
Exactly.
Okay.
So when it starts attacking it, it recognizes it as something that is not normal. However, the immune system has a problem to get rid of it.
Okay.
Right? So that's what's called like a dysregulation with the immune system. So then that tissue keeps like inflaming and keeps growing in different places in the body. And the body
so it can spread anywhere in the body.
Yeah. So most commonly it's like within like the pelvic organs, right? The ovaries, the fallopian tubes, in the area outside of the uterus. Those are the common places, but it has been reported, around the bowel, the bladder, in our spine, in the brain, on the skin. Any organ that you think about, endometriosis has been described and found. So.
And what does it do when it starts? When it gets infected, what are like the signs and the symptoms and stuff like that? Because I've always heard it's like grossly diagnosed, or just people are living with it. But why? What are the signs and symptoms that are being misdiagnosed?
Right. So it's a very confusing disease, right? Because the main representation is basically pain with menstruation, right? So every month that you get your period, you have pain, which is something that a lot of women report. At the same time, it can be chronic pelvic pain, so a cyclic pain, basically, that you have pain in your pelvis, even maybe not throughout your period, but also other times during the month when you ovulate, or different other times throughout the month, but it's cyclical, right? It keeps returning and returning.
Okay.
Another thing is another dominant part is infertility. So women that have problem to get pregnant, basically. So that's a massive thing, right? Because up to 50% of the women that suffer from endometriosis have infertility. And up to 50% of the women worldwide who suffer from infertility have been found to have endometriosis. So there's a really strong link between the two.
Got it. Okay.
And on top of that, you might experience pain during intercourse. You might have some abdominal bloating. You might feel some urgency and frequency with urination. There might be changes in your mood, like mood swings, maybe fatigue. So when I talked about it, there are a lot of different symptoms, right?
Yeah.
And it's very confusing, right? Because you might think that, if you feel bloated, or you feel like, like some patients or women that have like IBS, they might think that, it's IBS, or if you have...
that would be me.
Yeah. So that would be one thing, right? Or if you feel pain in your lower back, so you think, you might need to go to an orthopedist to evaluate and see if there's any problem in your spine. Or another thing is that if you have any symptoms that are related to some migraines or headaches, and then you go to the neurologist, so a lot of things might get you confused because it affects so many different systems in the body, right? And because of that, a lot of women get diagnosed really, really late. We're talking about like an average delay of about 11 years. So think about it, it's crazy. You will suffer from symptoms averagely 11 years before you're going to get diagnosed, right? So that's a lot of time to suffer from these symptoms, right? And you know, the way that it manifests, basically, you know, those are like lesions, right? Those endometrial cells that we talked about that cause endometriosis, basically, are, you know, might be cells that creates the inflammation, and then those lesions can be superficial. They can be, you know, on the lining inside, you know, your abdomen or the pelvis, or they can go deep, you know, closer to, let's say, nerves, blood vessels, into bowel, into the bladder, any of those organs. Okay. You can have like cysts, which is basically like sacs full of fluid, but those can be in the ovaries, so that can affect fertility. Okay. You can have organs attached to each other, right? So generally speaking, when you think about, you know, the abdomen or the body in general, things are not supposed to get stuck to each other. They're supposed to be free. Right. Right. But with endometriosis, because of the inflammation process, it causes, you know, some, let's say, organs get attached to each other.
Like almost fused together.
Fused together, exactly. So you have like the uterus gets fused to the ovary gets fused to the bowel. The uterus gets fused to the bladder.
That does not sound ideal.
At all. Okay. And that leads to pain, right? Okay. And on top of that, you might experience, you know, some of the women that have endometriosis might experience also heavy menses, and, you know, with blood clots and very heavy. And, you know, when you think about it, it kind of like resemble a lot of things, right? And it sounds very non-specific. Yeah. So we talk about 1 in 9, but in reality, probably the numbers are even higher. Those are just the women that have been diagnosed. And we'll talk in a second on how you diagnose women with endometriosis.
Yeah, I was just going to ask that.
But think about all the women. Well, let's start first. There are some women that have endometriosis who are asymptomatic, meaning that they have no symptoms. Those are very specific, but they have some. And how do you know? Because then you go and you diagnose them for something else, and then you discover that there's endometriosis. Okay. And then you have the women that just don't want to go and see a doctor, right? So if they're not going to go and see a doctor, the chances of them getting diagnosed is really, really low. Right. Unless they diagnose themselves, but it's not officially. And then you have the women that go to a doctor, but the doctor does not pick up on the fact that it's endometriosis. And then they do the run around and go around and around and do a lot of testing for different things, but just not for endometriosis. Right. So the numbers are probably even higher from what you're saying. You have 9 friends, right? Like, yeah. I mean, you're very popular, so.
I hope so. Yeah.
Right?
Yes.
Yeah. So think about it, that one of them has endometriosis and she might not even know about it, right? Because women are...
That is so scary.
Yeah.
And I keep hearing more about like how many women are like with fertility, with all the pain and stuff like that. And I think for women, me included, like if you are like having cramps and bloating and stuff, I don't know, really heavy periods, bloating, like my back hurts, like all these things. I'm like, I have all these things all the time. So how would I know if it's that or not? I've never been tested for endometriosis. I've never done, and many of my friends like have different issues, but you just, as a woman, you're just like, oh, it's part of it.
And exactly that's the thing. Society has taught us, unfortunately, or made us think that this is natural, that women should have pain and women should suffer during their menstruation, and it's like a normal thing. Right. And it's not, because not every woman has pain, and not.
Wish someone told me that a long time ago. Where have you been all my life?
Hey, as long as we're starting now, it's never too late, right? Okay. But yeah, I mean, this is not normal. So anything like that, I mean, I always say if there's doubt, there's no doubt, right? And the thing is that if you have any of the things that we described, we're going to go back to it. But you know, it's something to raise the suspicion. I always say that I think that the woman knows the best. Like you go to a doctor and you tell your symptoms, but nobody can, you know, tell you that what you're saying is wrong. And you just need to, if you're a good doctor, you just need to listen. You need to listen really carefully to what the patient describes to you.
All doctors don't do that. Like you tell them what you're feeling and they tell you why you're wrong, or what you think might be an issue, and they're like, no, you're wrong. like, listen to me. This is what it is, and they're not really.
So when
they don't really listen.
Yeah. So when that happens, you know what you need to do? You need to go.
Oh, Dr. Ito.
That too, yeah. You should always call Dr. Ito whenever you can.
Yeah.
But you should get a second opinion, basically. When the doctor doesn't listen to you, whatever it is, you should always have a second opinion. If you feel like your questions have not been answered, I mean, the symptoms that you describe have been, completely dismissed. I mean, you should always go and find a doctor somebody that will listen to you and will be able to assist you, right? Because at the end of the day, with medicine, it's people to people. So you really have to feel that you have a good connection with your doctor and that you're able to trust them, that they will take you through this process.
Right. And women are pretty intuitive, I think, like with their bodies. It's like you might not know exactly what's going on, but you know when something's wrong.
Right.
It's like having someone believe you. Like, that's the problem a lot of times.
Right.
I don't think women are given enough time or just like validation for their issues.
Yeah, not enough time, not enough validation. I think that's part of the reason why we're here and why we're doing what we're doing.
Absolutely.
Because we want to empower women, and we want women to take ownership over their bodies and over their health, and to educate them to know better about their life, about what they can do better for themselves.
Absolutely. So we're the only ones that can do it for ourselves. No one else is going to advocate for us.
Right.
We have to do it for ourselves.
100%. Yeah. So that's an important part. And with endometriosis, the way that you diagnose. So basically, as I said first, you need to listen. You need to go to a doctor and somebody that can listen to you and understand, and get the full story about of all the symptoms that you just described. Mm-hmm. And then need to do a thorough physical exam, basically to evaluate, because there are also, through the physical exam with the gynecologist, there are also some things that you might be able to feel that might raise the suspicion now. Okay. Like, maybe there's some tenderness in certain areas, maybe you might feel something, you might see something through the vaginal wall. So all those things are very important. Then afterwards, you might need to do some imaging study. Let's say an ultrasound, possibly could do an MRI. But having said that, all of those things don't confirm that you have endometriosis. The only way, the gold standard, right, to confirm 100% that you have endometriosis is through a procedure that is called laparoscopy. Now, laparoscopy is a surgery. Okay. So the patient is being put under general anesthesia, and then we make a small incision, really like a tiny, maybe 5 millimeter, through the belly button, and then we fill out the abdominal cavity with a CO2. So basically, your abdomen, grows like that, and then we put a scope, basically, which is a camera, through the abdomen, and then we look. Okay. And then, life is not like Instagram, so once you go in, it's not like you have hashtag endometriosis and everything pops in like not really, I wish. Right.
It makes your job really easy.
I know, it would have been great. That's a startup. But the thing is that also with endometriosis, you have to be really experienced in recognizing how it looks, because it can look, as dark spots, it can look as red spots, it can look as white spots, it can also be transparent spots, and you might not even be able to see it,
Why does it look different on everybody?
Because it has the ability, that's the thing, it has the ability to imitate a lot of things.
Oh, really?
Yeah. So
like the chameleon kind of thing, where it just kind of
absolutely.
Oh, wow.
And also the locations,
That's
right?
scary.
Yes, and the location of the lesions also, it might be in locations that you might not be able to see straight away. So you have to really look carefully, right? Because not everybody has the same pattern, right? So you might have lesions over here, and the other one might have lesions, next to the liver, and so you have to look all around and make sure. But once you see it, it's confirmed that you have endometriosis, right? Okay. Now, with endometriosis, it's very interesting because there's no correlation between the symptoms and the severity of the disease. So you might have a lot of symptoms, and then maybe during the diagnosis you will find out that there aren't many lesions, or the organs are not stuck to each other as much as you think, or no like lesions that go deep.
Yeah.
And potentially it could be the opposite. You might have really like no symptoms or mild symptoms, and then there'll be a lot of visits. Yeah, right. So you can't really trust the symptoms completely.
Okay.
But the idea is with the.
Can you have it with no symptoms?
You can. You can be rarely, but you can be completely asymptomatic.
Okay.
And then you can discover, so I had a patient, not going to mention her name obviously, but she came to see me for a different reason. She had fibroids. I mean, we'll talk about fibroids in another session,
right.
Which is another gynecological condition, very common. And so she had to undergo an operation. And her symptoms were, she had nothing to do with endometriosis. She was completely asymptomatic, something very specific about her, and was very, the direction was very clear that it's fibroid, and then I operated on her. And then once I went into the abdomen, I was like, wow, it was like spread all over the abdomen, the pelvis, the abdomen, and I was shocked because she had no symptoms. And
what do you do for that? Like, and what was the outcome? Because did it make her infertile, and was it like, I just don't know. That seems so bizarre to me. Like, what do you do in that situation? If it's spread all over, can you get it out?
Yes. I mean, you treat the, well, with her, we remove the fibroids, but at the same time, since I'm also like a surgeon that endometriosis specialist, so at the same time, I also remove the lesions and all the adhesions, which means, basically that organs are stuck to each other. So I took care of that at the same time as I performed the surgery, and because, I knew that it has some impact, obviously, and obviously before the surgery, she signed informed consent, and I explained to her that if there will be anything additional to removing the fibroids, we'll take care of it at the same time, because you always have to discuss with the patient the plan, and they have to agree. You can do just whatever, whatever you want, just take out organs and remove anything that is related to surgery. So we took care of that. We removed that, and then removing that also came back as as positive for endometriosis afterwards when we sent it to pathology. But it was very clear just by saying it that it's endometriosis. So you have that group of patients that might be asymptomatic, that have no symptoms. Majority of the patients do have symptoms though, and it does affect them in one way or another. So let's say, think about all the patients, and like fertility is a huge issue, right? Infertility in this day and age. So think about all those women that are suffering from infertility, and they just. And
it's because of endometriosis,
but they might not know, right? So they suffer from infertility, and they go to the fertility doctor, and they go through IVFs, and they go through egg freezing.
Because they don't test you for endometriosis when you go through all those things.
No, because a good doctor will have the suspicion to think that maybe there is, and then what they need to do is to refer you to a guy like me or an endometriosis specialist that really deals with this complex condition, because it's really complex to diagnose it and take care of it, right? But it's not only surgery, right? At surgery you diagnose, and then you remove the lesions, and you remove the adhesions. When that means that organs are stuck to each other. And that improves the quality of life significantly, and it also improves the fertility rate, right? So, like your chances of conceiving, if you weren't able to conceive before, after proper treatment, like surgically, goes up tremendously, up to even 60%.
Oh, that's amazing.
Yeah, and then you also treat them, if fertility is not an issue, and you're not thinking about getting pregnant, and majority of the symptoms are quality of life, meaning pain related, then you can treat also with medications, right? So you can treat with pain medications to relieve the pain. You can give hormonal treatments such as IUD with hormones, oral contraception with hormones, in order to decrease the level of endometriosis, all right?
So your hormones are connected to endometriosis. So if you use an IUD or contraception is it estrogen or progesterone or both? Or
so ideally for endometriosis, so endometriosis is estrogen-dependent disease, meaning that there's, as with a lot of things in the woman body, there's hormonal imbalance.
We're hormonal crazy people.
And
sometimes.
And so the estrogen level is really high, right? And when the estrogen level is elevated, that kind of creates like the inflammation, makes the endometriosis more inflamed. So think about like a bonfire. Okay, this is the endometriosis, and you just
lighter fluid or something.
Exactly, and you take just like a lighter next to it, and that's basically the estrogen. It like makes everything like blow up even
Got
more.
it.
So you want to lower the level of estrogen because you want to prevent the endometriosis from growing and getting more and more inflamed, basically.
And you do that with like a low dose of estrogen or with like progesterone or something? Does it balance each other out, or that's completely separate? No,
so the first line, it's kind of along the same lines of what you described, so I'm just going to clarify.
Okay.
The idea is to avoid estrogen as much as you can. So basically when you take medications, whatever contraception it is, basically the way that it works, it kind of sends a signal to the brain, and there's like, we won't go through the whole process, but it basically that signal sends like a negative feedback to the brain, stops secreting the hormones that eventually will cause secretion of estrogen and progesterone from the ovaries. And while doing that, so there's like a shutdown of that axis, and then basically you have less estrogen floating around.
Which means it's going, like the endometriosis is going to go calm down itself.
Exactly, it's calming down the endometriosis.
Okay.
Now, the best way to do it is not using estrogen at all. So we have some products that are based only on progesterone, such as an IUD that is based only on progesterone, like Mirena or Kylina, Janes, that are all like based on on progesterone only, okay? Or you can have oral contraceptives that are, progesterone only pills.
Okay.
And those work, in a way that, those pills or IUDs send a negative feedback to the brain, and then the body stops secreting estrogen, basically, right? And then it comes down the endometriosis. That's the first line. Potentially you can use also oral contraceptives or NuvaRing, which is like a ring that you put in the vagina with hormones, that's contraception, that has estrogen, and that also creates that block to stop releasing estrogen from the body.
So it has estrogen or progesterone?
It has estrogen, but the amount of it is very minute compared to what the body is able to produce. Right?
Oh, okay.
So with this kind of contraception, let's say with the pills, if you take it continuously, and also with some of the IUDs, after some time you stop getting your period, but majority you still get your period, but to a lesser degree. The idea is that, if there's no menstrual period, then there's no menstrual pain, right? And if you're not ovulating, so then there's no pain around ovulation. So you're kind of trying to block it at that level in order to get rid of those symptoms. So, so it all depends on the indication. Like I'm saying in general, like medicine, it's science, but it's also an art. Yeah. And the way I look at it,
And you're an artist.
And I'm an artist. There you go. It's not either a 0 or 100. I mean, like in life, there's like
there's always a middle ground. Exactly. There's always like different levels of everything.
And you have to take it, and see exactly where it takes you with every patient.
Right.
So, you have to see if like the medication is the right thing for the patient, or you have to combine it with surgery to remove and then treat with medication, or if their interest, obviously. If you're trying to get pregnant, obviously taking oral contraception and putting an IUD, probably not going to work.
Probably not.
I think probably
I'm
not
a doctor, but I'm thinking
you're almost a doctor right now. And so you have to really fit the right treatment to the right patient. And on top of that, you have other things that might help, such as lifestyle modifications, right? So changing your nutrition. So there are some things that are counterproductive to endometriosis with the stuff that you eat, right? So,
what kinds of things are bad for endometriosis?
It could be that food that is like rich in gluten is not good, or milk products, processed food, fried food, food that is rich in sugars or salt, basically all the good stuff.
Yeah.
Yeah. So
just eat very clean and healthy, like fruits, vegetables, like very just
organic, very clean.
Okay. Basically, what they've been telling us to do, like this whole time, if we actually do it, it's gonna probably help.
Yeah, just like those national drugs, you know. Just saying,
I'm a great example.
Amazing.
Look, there's the vegetables. We got some tomatoes, fruit, because fruit's actually, or a tomato is actually fruit, right? They say we always think it's a vegetable, but it's really fruit.
Actually a fruit.
Yeah, and then avocado. We got some
also
corn.
Yeah.
This is corn.
Yeah. All right, so actually,
kilos agave.
Amazing. So
I am the worst person to have on here. I don't have endometriosis, by the way, though.
So you can eat this stuff.
Yes.
Yeah.
Okay. In moderation. Everything in moderation.
Everything always in moderation.
Yes.
I mean, but changing your diet really affect, right? Because the idea is that the thing that your GI tract, the gastrointestinal, all the bowel, like it goes all the way in your abdomen, it goes down next to, goes down in the pelvis. So when the bowel is inflamed, right, because of this type of diet that we're consuming, which is probably not the best for us, but we're so used to it.
Right.
So it also causes inflammation of endometriosis, to simplify things, right? It's not exactly like that, but when the bowel is inflamed, it might cause inflammation and might make the endometriosis even worse, right? So you can make changes to your diet. Another thing is, all the Eastern medicine things, such as, acupuncture and homeopathic medications, reflexology, different types of massage. Now, those things are very individual, right? Because you have to see what works for each patient. Not everybody likes, to be stabbed, with acupuncture. Some people
it's not that bad.
I've
done it.
But some people have like,
Needle,
fear of needles.
Right.
I mean, that might be the worst thing that they can ever experience. So you might not want to push them, towards that direction. But in that thing, again, you have to feel the patient, always have a discussion and see, and suggest that and see where they're going with it.
Okay.
Physiotherapy, like pelvic physiotherapy, yoga, specific type of yoga for endometriosis, or
they have a specific type of yoga for endometriosis.
They do, yeah.
What's it called?
Endo yoga.
Oh my gosh, I didn't know that.
Yeah, so it's like a specific type, where the positions, you don't push yourself all the way, and like certain positions that are aligned with endometriosis. And a lot of patients, I mean, it doesn't work for everybody, but a lot of patients describe and say that it really helps them with the symptoms and improve the symptoms.
That's amazing.
Yeah. Pilates, all those things that this type of physical activity that helps strengthen the core muscles, basically, right? It's really important and really good. Combine all of those, and you create basically circles of protection from endometriosis. Another big thing is cannabis. Okay, like medical cannabis. I treat my patients with medical cannabis as well.
Really?
Yeah, for chronic pelvic pain. Basically, a lot of patients are suffering because they used to pop pills like crazy. And we all know like what
it'll kill your liver and everything like that, and addictive.
Yeah, and we all know about like the opioids pandemic and what it caused, and the addiction and everything, that all the bad things that come with it. So if you treat with cannabis, which is a natural substance basically, so we have some studies to show that certain part of the cannabis get attached to the receptors basically of endometriosis, and may help to create down regulation of endometriosis as well, of the inflammation.
Really?
Yeah. So you treat cannabis for other conditions that are inflammatory in nature as well, and for other conditions in medicine in general, but we find cannabis to help also with endometriosis.
That's incredible.
Yeah. So add that. I mean, not for everybody again. It's
right.
not like But it's definitely something to discuss with your doctor and consider. I mean, because if medications are not helping you, or maybe you are opposed to taking so much synthetic medication, you might take something that is more natural, and you don't really have to smoke it. It can be oil, or you can vape it, or something like that, and it can be rich, let's say, with the CBD, and in order to decrease the inflammation, it might help you. So it's all of those things, you kind of like create circles around endometriosis and protection circles. So
that's really cool.
Yeah,
that's good to know.
And creating an ecosystem, basically, and that's how you treat patients with endometriosis, because it's a chronic disease, right? They always ask me, so after I treat them, they're like, oh, so now am I cured? Am I cured? And I was like, well, this is a chronic condition. So I always say that, endo patient is like, it's a patient for life. So I tell them that when we start the journey, then we become BFFs. Right? and
you're with them till the end.
Yeah. And then you take them from beginning to end. So at the beginning, a lot of patients suffer a lot, and they have a lot of symptoms, and it affects everything in their life. Also, it affects their personal life. It affects their life with their partner, work, social, their ability to interact with other people, physical, emotional, psychological, almost everything.
And 1 in 9 women have it.
1 in 9 women.
Probably.
Yeah. How crazy is that, right? To think that there's like a disease that is so common, yet not a lot of people know about it.
So how do women, what would you recommend, like when women go into their gynecologist and they're like, just for a normal checkup or a pap smear, so can you find it in a pap smear? No? Okay. So if your pap smear comes back like normal, and you think, okay, I'm good, but still having severe cramping, severe periods, like all these things, and you tell your doctor, and they just kind of like, okay, yeah,
that's normal.
Yeah. What do you do besides go to another doctor? But is there something where you're like, no, I want this test? If you ask a doctor like that, do they normally? I mean, I guess it varies, but do they normally comply, or can you even ask for a specific test to test for it, or you just go to a different doctor that will actually listen?
I mean, I think the best thing is to actually go to somebody who specializes in it and somebody that actually treats this disease.
Okay, so what age can endometriosis actually start taking form? Like how young?
Right. So endometriosis is basically at any age of fertility. Basically, from the moment that you get your period until you stop getting a period, every point on that track is basically a fair game to have endometriosis. So you can have teenagers that actually have endometriosis that you might obviously misdiagnose it because everybody's, oh, you have pain. I had pain. It was, the mother might say, yeah, it's normal. You have pain. So it can start as early as as a teenager when you start getting your period, and it can go all the way up into menopause when you stop getting your period. And there are also some reports describing that even women after they stop having their periods still suffer from endometriosis because, to a lesser degree, but still possible to have endometriosis.
So if you find out you have endometriosis, say at like age 25,
right?
You would have that until, would it go away once you go into menopause, or you just stop having symptoms?
So, excellent question. So, once, since endometriosis is being influenced so much by estrogen, so what happens during menopause is that, the ovaries start producing less and less estrogen and progesterone.
Uh-huh.
And with time, basically, it's a shutdown of the ovaries, right? And when there's a shutdown of the ovaries and there's no estrogen, basically, to a lesser degree, there's nothing to stimulate the endometriosis anymore. So it also kind of like dies down, if
Oh, okay. So it doesn't really go away, but or can it completely go away?
At that point, we What's up, buddy?
Okay. I think Thor wants to join this conversation.
Yeah, we can all go.
Okay.
Yeah, okay.
He wants to know, what if he has a girlfriend with endometriosis?
Absolutely. It gets worse and worse. It progresses. It's not a static disease.
It progresses.
Yeah, progresses.
Okay.
And it can start progressing from a younger age, right? And it can also start just in the middle of life, right? So it doesn't have to be that you start feeling the symptoms when you're a teenager. You can be 20 or 30 or sometimes 40. All of a sudden those symptoms starts to kick in. So it's not all or nothing like the rest of the things that we talked. There's like everything. It can be from early on, it can be later on, it can be in the middle, it can be all of a sudden after delivery, it can show up after a miscarriage, it can show up after a C-section. And
so it's just always there, and basically because of the difference in your hormones or something, or is it something genetically where it's always going to happen, and it just hasn't happened yet?
So in regards to genetics, basically, we know today that the disease has correlation to genetics, basically, because we know that in some families that endometriosis is very prevalent.
Okay.
We have found certain genes or certain parts in genes that are very common specifically with patients with endometriosis, right?
Okay.
Now, this is still an area that is being investigated, and we're still studying and trying to figure it out more and to gain more and more information. But generally speaking, if we talk about endometriosis, we know that if you have a first degree relative that has endometriosis, your chances of, not you, your friend chances of having endometriosis, 7 to 10 times more than the general population. So think about it like how crazy it is. And if you're talking about like sisters or twins or so, those ratios go even higher.
Wow.
So once you have endometriosis in the family, and so part of, when you talk with a patient, part of taking the history is also ask about family history.
Okay.
And since, patients were not aware of it, let's say, like so-and-so years, at the age of our parents or grandparents. Right. So I asked if there were like similar symptoms, because it might have been endometriosis and nobody diagnosed it, so you don't know, but all of a sudden they're like, you know what, doc? Yeah, my mom says that when she was my age, she also suffered from the same symptoms. Right. And my grandmother had, she had some surgery, and I'm not sure exactly what kind of surgery, but when I asked her, she said that she had similar symptoms and then she underwent surgery, so it didn't show up from nowhere. Right. My point is that it was always there. And if you look also I'm like a big history buff, so I like to really research.
So what year was it that it figured out?
So this so if you go back and you read, you see that even back in the ages of Egypt, back in the days, and Rome and
really?
Greek, and Greece, you can find some descriptions of women suffering. And it correlates with endometriosis basically. And they used to call it something like crying uterus or choking uterus. Basically, that the woman was suffering so much that and they didn't know what to do. And you see also those paintings on hieroglyphs or whatever it is from the times of the pharaohs that you see, things like that describe women suffering like that, and that the uterus is suffering
long, and it's still being misdiagnosed and stuff. It's still,
how crazy is that, right? Yeah,
that's just sad.
Yeah, it is absolutely. This is part of,
this is why you're here talking about it too.
And this is why we're talking, because we're trying to, the whole idea is to educate and change the paradigm, right? Yeah. We're trying to raise awareness and really to empower women to know more about their health and to be aware of their bodies and to ask the right questions and also to advocate for themselves about their health. Not to say there are great doctors out there and some women are getting answers, but generally speaking, from the sense that what we're getting, there's a gap, and we're trying to bridge that gap.
Yes.
And really to help and raise awareness. And when you think about a condition like that, which is so common.
Yeah, it's brutal for women, and if it's going to be generational as well, that's we have to figure it out. We have to spread the word. So everybody share this with your friends and your family and everybody, because how cool would that be if you and I just like ended that cycle where it was all like back in the day with the pharaohs and stuff talking about it, and it's still like only like still not diagnosed and still not that well known and everything. What if we did that and then everybody knew about it and it started getting
and then,
taken care of better and stuff? That's a cheers moment right there.
Yeah. Cheers to that.
Cheers.
And that means that it will end right here, you know, with like diagnosing endometriosis. But yeah, that's the idea about like spreading the word. I mean, this is specifically now like we're talking about endometriosis, and you know, we'll do other like, you know, we have planned to talk about many different things.
We're talking about a lot of things.
Anything that is like, you know, women health related, but you know, changing that shift, you know, because I do believe that, you know, 50% of the work is to be aware of things. So to be aware that there is a problem, to actually understand. And as you asked me before, what to do, you know, if your doctor does not agree with you, does not listen to you, then I say, you know, find somebody who does. I mean, that as simple as that. I mean, if you're not getting the answers, or you're not getting the right
quality
support
of care, like where they're listening and validating like your symptoms and how you're feeling. Maybe it could be related to something else, but they need to actually take it seriously.
And they need to investigate, right? And if you feel that there are some questions that are not answered, or that you need somebody to elaborate more on your condition, go to somebody else and find also the doctors. I mean, nowadays, I mean, with Dr. Google, you can Google everything and find everything. But I have to say that you have to be careful, because Dr. Google
I've gone down a dirty rabbit hole with WebMD, and I'm like, I knew before I did it, I was like, I shouldn't do it. I'm gonna spin out, and then you go down WebMD, and it's like, then you think like you're gonna die the next day. It's like, no, maybe just talk to a doctor, like when it listens. Don't try to diagnose myself. I did not do medical school, so.
And so you have to be careful with that. I mean, there's a lot of information floating out there, I mean, in the internet, which is a great source. But you have to take it with a grain of salt. I mean, not everything that is written over there is exactly what's supposed to be. So go to a doctor, you know, let's say your family physician, if they're aware of it, should refer to an endospecialist. Your OBGYN, you know, definitely should refer to an endometriosis specialist. And I mean, even with a specialist, you know, if you're not getting like if it's not the right vibe, or you're not, you know, connecting, at least you get heard, and then you can go for a second opinion. But definitely, like, you know, get on track, take care of yourself. Don't ignore it. I mean, the fact that if, you know, I always say, if you put your head in, you know, in the sand, that does not mean that it doesn't exist. It just means that it's going to continue, you know, by the time that you pull your head out of the sand. And since it's a progressive disease, it just means that it's going to get worse and worse. And so you have to take care of it and address the issues as early as possible.
Okay.
Yeah.
Well, thank you.
My pleasure. Well, so that was, you know, us talking about endometriosis.
Yes. What's next? What's on the next session?
I mean, there are a lot of exciting things.
Eeny, meeny, miny, mo.
I mean,
there's so many.
You just pick and choose. I mean, women's health. I mean, it's a world, right? It's a whole world of, you know, interesting stuff. Complex.
Gotta love the complexities of women.
Yeah. But there's so much to do and so much to, you know, to talk about, to change it, change things. And that's why
Well, you are an angel. So thank you for helping so many people and for helping me get the word out there. And me helping you get the word out there.
Exactly.
Actually.
I mean,
we're getting the word out there.
We're getting the word out there. Yeah.
Okay.
So cheers to that.
Cheers.
And until the next time.
Yep.
Yeah.
Cheers.
Cheers.